Good afternoon, everyone. We are from Tianjin, China, and we are going to talk about the COVID-19 promote the development of a new colorectal cancer screening process in our center. Actually, it's not about all the cancer screening in China, but only in the Tianjin center here. So I will talk about how the COVID-19 pandemic impact on the colorectal cancer screening in Tianjin, and how we continue to do this screening project and what we have done so far. As we know that the outbreak starts at the end of 2019, and from the State Council Information Office of China, we summarized 5 stages about how China fight against the pandemic. And basically, we can see from the outburst and to the end of April, we are taking a lot of efforts to fight against the virus and to finally to control the cases to single digits by the middle of March, and then Wuhan and Hubei province was stopped the lockdown in the beginning of April, and since April the 29th, we started an ongoing called ongoing prevention and control to fight against the COVID-19 until now. And how did the pandemic impact on our screening projects? Actually, we have to say our CRC screening project suspended until May 2020 because the numbers of the screening participants decreased substantially. There are two main reasons. The first is the prevention and control of the virus requires a large amount of manual labor, and our medical professionals and workers at healthcare centers and hospitals moved a lot to fight against the virus, and we don't really have enough manpower for this cancer screening project. And actually, for the patients or the target population, the awareness of self-protection raised a lot, and they don't really want to go out of their home and to increase their social contacts with others. So we don't really have the chance to do much more work on this. And during this period, we are trying to establish a new screening process, which includes a new established department of general practice and another preventive treatment center. And we also used additional detection kits to in the first round screening to promote the positive prediction value. And finally, we restarted our screening project since October in 2020, and we finally achieved that there is a increase in numbers of the participants. So this figure shows the 3 levels of hospitals in China before the COVID-19 pandemic. Actually, we are doing the screening projects in all kinds of hospitals, including tertiary hospitals, and we also do this in secondary hospitals, in primary hospitals. It's kind of random, and the patients may go to each level of these hospitals, and we don't really have very good data collection methods. And after the May in 2020, we rescheduled the screening process. The patients are mainly from, the patients should follow the first baseline survey, including questionnaire, and we dispatch the detection kits and retrieve the kits. And then if they are tested positive, then they will get it to the secondary hospital to undergo a colonoscopy. And then if they found there may be some tumors or cancers, they will go to the tertiary hospital for further treatment. So this is a little different from what have done before. So now, please allow me to introduce our key person in this screening project, Dr. Li Chunyan. She will tell us how we do this screening process in Chinese, and then I will try to translate it for you. Okay.
好，大家好，我是来自天津市南开医院全科医学科的李春燕。下面呢，我向大家汇报一下我们大肠癌筛查的情况。我们呢，在2020年的11月到12月2个月的时间里，集中完成了1.3万例的大肠癌筛查。本次筛查呢，是在我们南开医院中西医结合智卫院体系下的大肠癌筛查优化项目。这个整个的筛查过程呢，是由我们全科医生进行主导的。我们呢通过医联体的途径，在功能社区和地理社区呢，进行健康的宣教，提高居民呢对大肠癌的认识，从而呢大大提高了我们筛查的参与度。我们筛查的参与度呢现在达到92%。同时呢，我们还搭建了信息化的平台，实现了智能化的管理。我们通过小程序对受检者的资料进行收集。同时呢，建立了筛查档案，对于他的身份呢进行了识别，这样呢有效的避免了公共资源的重复的利用，而且呢方便受检者对于他的出筛结果进行一个自行的查询。同时呢，我们还通过信息化的平台进行科普知识的推送，还有一个线上的讲座培训，这样呢持续的提高受检者的这个认知对于这个信息化的平台呢，还可以帮我们存储筛查的数据，提升了我们筛查的精度。我们本次的筛查呢，出筛的方法呢，利用的是粪便的基因检测和 FEED， 还有呢就是我们的问卷调查。通过这些方式呢，大大提高了我们出筛的一个检测性能，减少了维修长性，也降低了我们后续的诊断成本。
Okay, this project is a project of Nankai Hospital in Tianjin, and it's called a promotion project of CRC screening. And this project is led by the general practitioners, and the participant rate reached over 90% in our project, and we used high-risk factor questionnaire and fecal DNA detection kits, apart from FIT tests that we used in the past. And we also used the mini apps on WeChat, which is an instant messenger that is widely used in China. And by using this method, and we have reached a higher participant rate, and we also have better ways of data collection. And by using new methods like fecal DNA detection kits, we intended to reach a higher positive prediction value, and to reduce the innocent colonoscopy and to reduce further costs.
在整个筛查的过程中我们全科医生从整体出发，对于大肠癌筛查的这个受检者进行了全程的管理，赢得了我们筛查对象的信任，从而呢也提高了我们筛查的依从性和获得感。我们将筛查的人群呢分为2大类，第一部分呢是低危人群，低危人群呢又分为2小类，如果他没有伴随其他的疾病，就进入我们的健康管理。如果伴有其他的慢性病呢，就进入我们相关慢病的慢病管理。但对于高危人群呢，我们要进行的就是内镜的检查。我们全科医生呢，通过主动宣教的方式，提高了我们肠镜的依从性。现阶段我们肠镜的依从性呢达到80%。同时呢，我们全科医生还负责高危人群的肠道种类的指导。 使我们的肠道准备合格率呢达到了96%，从而提高了检出率和早诊率。同时在内镜检查的过程中呢，我们还加入了人工智能辅助结肠镜检查系统，这样呢，通过AI 的技术呢，提高了我们内镜的质量，增加了检出率。对于内镜检查后的人群呢，分为3大类。第一类呢，就是未见明显异常的人群，进入我们的健康管理。第二类呢，就是存在癌前病变的人群，我们通过全科和专科的无缝对接，绿色通道的转诊，进行住院的治疗，大大提高了我们的治疗率。对于治疗后的人群呢，进入我们的慢病管理。对于肿瘤的患者呢，我们找到专科，进行手术治疗，术后呢进行康复，康复后再到我们的慢病管理。我们全科医生对所有的慢病管理的患者都会进行规范的随访，防止复发。
Dr. Lee just introduced our standardized procedures for this research study population. After the first round screening, if the patient or if the participant is identified as a low risk, and then there are two situations. If the population is well-being or they are healthy, then they will just enter our health management system. And for the patients that we found there may be some they have some chronic diseases, they will enter the chronic diseases system management system, and we will follow up them upon the different disease situation. If after the first round screening they are identified as high risk, we will introduce them to undergo a colonoscopy. And for our project, we also tested a new real-time use of artificial intelligence colonoscopy, and we tested the effectiveness of the AI assisted colonoscopy on the detection rate of adenomas and polyps. And if the patients are they have adenoma or polyps or cancer identified, then they will go to the tertiary hospital for further therapy. And so we wanted to say that all procedures are led by the general practitioners, and for the results explanation and also for the colonoscopy results, and also the health management and chronic disease management and follow-ups are all conducted by the general practitioners.
在真实世界的实践中，我们形成了整合式的肿瘤筛查方案和中西医结合的慢病管理方案，并进行推广，使更多的人受益，真正的实现了这个慢病管理和肿瘤筛查的标准化建设、规范化管理、智能化运行。
By conducting this project, we actually built up a standardized system for further application in different areas, and with the aid of online data collector, and we wish that they can this procedure or this process can be used in other places. Okay, so then I will continue to show some very preliminary results. Actually, for our project during October the 28th to February the 20th in 2021, we actually recruited more than 13,000 participants in our screening project. And for a single day on November the 27th, we recruited more than 600 participants. That's quite a lot compared to the past. And we dispatched the detection kits for all of them, and over 90% of them retrieved, provided their samples, stool samples to us. And finally, we tested positive. Nearly 6% of them are tested positive. And this BGI and ColorSafe are the two DNA detection kits, and this is FIT results. And for the questionnaire, we actually ask questions including this including these questions, and we can see actually near 10% of them performed colonoscopy in the past, and nearly 5% of them has a history of colorectal polyps, and these are they are very preliminary results, and we find there are nearly 1,000 patients followed the colonoscopy procedures, and the real positive or the positive prediction value is over 60%. So this is all for us. Thank you. And so we want to thank all the participating centers and the staff members of ours, and also the participants. Thank you.